Everyone's talking about andropause, and Dr. Berger is going to be here today to explain what andropause is.
So andropause is a condition that we sometimes use to describe testosterone deficiency in men. And this is almost an epidemic in today's society. We see this a lot. It usually starts when guys are in their 40s and their 50s. And it's a very insidious kind of thing, kind of creeps up on you. But it's often ignored until it's too late. The men that we see usually, they feel nonspecific fatigue. They lose their sense of well-being. About 60% of them have joint aches and they get stiffness in the hands, and about half of them get actually the same kind of symptoms as the ladies do in menopause with hot flashes and sleep disturbances. About 60% of them, they get irritable and they get angry, and about 70% of them suffer from depression. About 80% of them get a reduced sex drive and a reduced sexual potency and performance, and pretty well all of them start to suffer from some premature aging involving the skin and the hair. But the bottom line, the common denominator, is that there's a loss of the male hormones, or androgens. And these would include the hormones of DHEA, which is dihydroepiandrosterone, androstenedione, dihydrotestosterone, testosterone, which is the one that we commonly know, and estrogen is actually also involved here, which, interestingly enough, estrogen is derived from testosterone in men and women. Now, with this andropause, with this testosterone deficiency syndrome, what you're going to see is you're going to see an age-related decline, which is going to affect things like loss of muscle volume, loss of muscle strength. Actually, as men get older, in their older age, this loss of muscle volume and strength can lead to a frailty type of problem where you can have increased risk of falls and fractures, and we see this quite commonly in older men that have this deficiency. You can get an increase in your percentage of your body fat, and you can get large breasts, abdominal fat and hip fat, even something called gynecomastia, which is like male breasts that can occur. It can result in a decrease in your bone mass and put you at risk of a condition called osteoporosis. And certainly can decrease your sex drive significantly. You lose your nighttime erections, you lose your firmness of your erections, and definitely lose the stamina, which is a very significant issue for men, of course. And there definitely is something very interesting here, and that is the decline in the level of testosterone that we measure usually comes well before the decline in the performance. Now, overall, there's a decrease in well-being. These guys feel emotionally volatile. There's some reduced mental energy, reduced physical energy, and in addition to all that, you get just a decreased feeling of vitality and vigor. And guys will develop something that we call an irritability syndrome, or a male irritability syndrome. And this is often the first symptom that they'll feel, and it's usually the hallmark for this androgen deficiency or andropause. And we can measure it. I measure it by an emotional mood inventory type of exam that I use for men, and it works also really well for females who are suffering from hormonal decline. In addition to all this, for the age-related problems, there's a decline in cognitive skills, in memory, in concentration, and there's an increased risk of heart disease and cholesterol increase. Now, the mental and emotional changes occur both in men and female patients, but they usually are related to depression, anxiety, lack of self-esteem, loss of confidence, loss of competitiveness, assertiveness, loss of a sense of well-being, and other symptoms that are usually associated with depression and anxiety. These are something that pretty well everyone who is aging can relate to in some way. This is one of the things that we notice in the so-called midlife crisis, because in that scenario, you get self-doubting, you get depression, and you get a lack of confidence that we can't accept. So overcompensating for that is what we see people do. They act out. And, like they divorce their wife for a younger woman, to prove their virility, or they'll go out and get a new sports car so they can feel young again, or they'll go out and start spending money, to counter how lost they feel. And this is something we have seen and is quite often observed. And, depression is a very common part of this syndrome, and 80% of suicides that occur in the United States are men, which indicates how men are affected by this depression. What does treatment do? Treatment improves pretty well almost all of these symptoms. It improves the mood, the sex drive, the sense of well-being. It decreases the depression. It increases the memory and the cognitive function. It prevents the bone loss. It improves the muscle strength and mass. It decreases the fat and increases the lean body mass. It protects the heart and improves insulin resistance and diabetes. So very significant improvements. And how do you treat this condition? Well, basically the treatment is by replacing what's missing, and that's replacing the hormone. In most cases, that's by giving the patients testosterone in some form. And this can be through injections, through creams and gels, through patches, through drops, through lozenges, through suppositories. There are various ways that this can be done. The most important thing that people are concerned about when it comes to these kinds of treatments is cancer. Everybody has this paranoia about this testosterone will cause cancer. And this is a total myth and has been proven without any doubt that testosterone does not cause prostate cancer. So this is not something that we are concerned about. On the other hand, what we need to do to make a diagnosis is certainly after somebody tells us about how they're feeling, and I've described all the things that people are feeling, and we examine them. Then we're going to measure things like their total testosterone, their free testosterone, their dihydrotestosterone, the sex hormone binding globulin, the FSH and LH, which are pituitary hormones, their PSA, which is a marker for prostatic cancer, and their estradiol. Ladies also have issues with declining testosterone during menopause. Men, there's mental fatigue, there's loss of concentration. You get this midday fatigue that most women who are in this position talk about. Loss of mental sharpness. Both short and long-term memory are affected here. There's a loss of creativity, and there's a loss of competitiveness, a loss of a sense of well-being, and definitely an increase in depression. In terms of physiological effects, well, there's no question that the patients will have increases in abnormal lipids, and blood sugar and insulin may be affected. And so treatment will improve these things by lowering the total cholesterol up to 10%, the bad cholesterol, the LDL cholesterol up to 13%, and also increasing the good cholesterol, the HDL. And they can get improved blood sugar and insulin resistance and decreased lean body mass and improved asthma and COPD symptoms. So they have many, many benefits from a physiological perspective. But physically, women will get increased sex drive and sexual sensitivity, including orgasm, by replacement. They'll be able to maintain the female genital system and organs, and they'll get a decreased sore body syndrome. In other words, less muscle aches, less joint pains, more flexibility, more mobility, and reduced stiffness. So they'll also be able to maintain better muscle size, tone, strength, stamina, and athletic performance, and in addition to that, help prevent osteoporosis. So that's an overview for you of andropause that affects men as they age, and it gives you an idea of all the things you can look for and all the opportunities you can have with correct treatment. Thank you.